Hello, everyone, and we are speaking today with the Pan American Health Organization, World Health Organization rep in Guyana, Dr. William Adu-Krow, and he will be sharing with us today um, from PAHO's perspective of the COVID-19 situation in Guyana, and in addition to what else he'd be able to tell us and share with us. Dr. Adu-Krow, thank you for being here with us.
Thanks so much for having me. I think it's a pleasure to share what we are doing with you.
Okay, Dr. Adu-Krow, so we're going to start off right away by just hearing from you as PAHO WHO rep. If you can give like an analysis or an assessment of the situation, the COVID-19 situation in Guyana.
Yes, no, thanks again for the opportunity. I think we were doing very well, and then we opened up society. And when I say we, government opened up society a little bit, and Region 4, they were plateauing. Region 1 had an increase and then plateaued. And suddenly, once we began to relax the rules, we have all regions having increases. Region 3 over the previous week had 25% increase. Even Region 4, that was well controlled, had 47% increase. So now no region is spared. Region 1 was well controlled. Now Region 1 is also seeing an exponential growth. So I think we need to look at the situation as a country and see where we're going wrong, and do everything to suit. We cannot continue with the status quo. I think people have heard about COVID-19, heard it over and over and over again, and therefore they are more or less immune, and they don't think it is more of an issue. It affects that person and not me, till it hits them, and they realize that it can affect everybody.
Okay, thank you for that response, Dr. Adu-Krow. So from that, we know that PAHO has been using a model to give projections of infections or how the situation will be at a certain time. Can you tell us a little bit about that model and what are some of the new projections given the current situation?
Okay, well, thanks so much for the question as well. The curfew is supposed to end at the end of this month. If the curfew ends at the end of this month, and the way things are going with the numbers, the increasing numbers that we are getting, we will have, by October, getting to October ending, we will have 473,000 cases. Now, if the curfew ends and we open the airport so that we assume that we get 1 case a day from importation, that number moves from 473 to 482,000. So that's the first modeling. Now the second modeling is if everything is pushed back to September 15, that's the curfew, everything, the airport closure, pushed back to September 15. That number is almost is reduced to 25%. So if we extend all the measures up to September 15, the number of cases projected will be 115,000. Now, if we open the airports after September 15, and we have only 1 case a day, that number goes to 125,000. Now, I think for me, what is more mind-boggling is it happens to be the number of hospitalizations, because 85% of persons who get sick are moderate and can stay at home, but 15% may need hospitalization, and that number comes to 3,482. And ICU alone is 940, and we don't have the capacity to contain that. However, if a curfew and airport closure is pushed all the way to September ending, now the number of cases we are looking at is 16,850, and if we have one imported case every day, that number jumps to 18,000. hospitalizations for only 429, and ICU 117. That means there is something to be gained by delaying. Now the question is, can we delay all the time? And the answer is no. There's got to be a point in time that we say that we have to balance our lives with livelihoods. People are bleeding, people are losing their income, and we have to also also show that people are also dying. And therefore, where do we find the common ground? I think COVID-19 is going to be with us for a long time. And therefore, it's high time that we find the middle ground. And that middle ground means everybody leaving your home will have to have a mask on. Once you're leaving home, you have to have a mask on. Do not leave home if you don't have to go out. I will also tell government, if possible, let's have 6 to 6. The curfew from 6 to 6. It's easier to monitor curfew 6 to 6 than 9 p.m. to 5 a.m. because people go out in the night and say, oh, well, curfew is at 9. Let me have one drink. And then they stay on till 8, 9, and then rush home. Well, even if they rush home, sometimes leisurely go home. I think we need to be more serious. Now, from what we are seeing, all regions are involved. All regions are seeing increased cases. Granted, partly because we've increased testing, but also the thing that bothers me is because of the fact that the positivity rate, that's the number that is positive out of the number that is tested, is around over 25%, which means there are a lot of people out there who are positives that we don't know. So please, I think we have to do the right thing. If the appetite is not there for more and more changing of dates and locking down society, then we have to do the right thing. We have to also enforce. If we do not enforce, people are just going to do the wrong things, and that's going to affect us.
Okay, Dr. Adu-Krow, as you've explained that, what I'd like for you to explain the model that PAHO uses, how you arrive at the numbers. Is there like, for every one case, you project 10 cases? Is it something like that? How does it work?
Yes, in the modeling, we also have what we call the effective reproductive number. That effective reproductive number means if I test for COVID and I'm positive, how many people am I likely to infect? And that number, we started off from about 3.25. That's if I get it, I'll infect 3.5 other persons or 3.25 persons. Now that number started coming down to a point that it was 0.3. Now that number gradually is going up and it's now 1.2. That is not good. The guidance is that if that effective reproductive number starts to go down, then it's a good sign we can begin to open up society. If that number is also less than 1, that is also good, we can begin to open up society. Now that number is increasing, so it's not good for us. Now that number is also above 1, and that's not good for us. We have to do the right thing.
Okay, Doc. Well, we know that the government has, the administration rather, they have started doing mass testing in all these regions, and that would have been aiding in, identifying these cases. And another thing I see they've been doing is self-isolation. Could you tell us a little bit about that?
Okay. Normally, when you are at high risk, and we test you and you are waiting your test, you go into quarantine. Now, the moment you test positive, you go into isolation. Now, let me say, quarantine can be institutional quarantine or home quarantine. That is, you can, even when you are waiting for your test, you could either be home or you could be in a government institution. Now, the same thing with when you test positive, you could either be made to stay at home or be in an institution. So home isolation, it means that person has tested positive. And the Ministry of Health has agreed for that person to stay at home whilst being monitored. And initially, as a country, the decision was made that all positives will be at an institution. Now we have over 1,000 positives with about 500 or so active cases. So they cannot all be be in institutions. And therefore, I think gradually some of them are at home. Once government realizes that they have home circumstances that are good enough, yes, they make them stay at home. And therefore, those persons stay at home. The first question you asked is government increasing testing. Yes, government has increased testing, but the original guidance hasn't changed. The guidance means, do you have fever? Do you have chest pains? Do you have a dry cough? And now we've also added things like, do you have GI signs like diarrhea, vomiting? Do you have loss of sense of taste and smell? All those things have now been added because from other countries we are beginning to see those. So I think that having been added, plus the fact that if you are a strong contact, then we test you as well. I think those have made our numbers go up. And the other thing that we also have to be mindful of is because we had only 2 main persons doing the testing, we began to have a backlog. And when you have a backlog, it means whenever that backlog is done, you have a bang. If you have a backlog of about 150 tests, then suddenly your numbers will increase by about 20, 30. And that's what we are seeing now. We are hoping that with more persons having been trained, we will now be able to clear the backlog so that we don't have to go through the big bangs that we are seeing all the time these days.
Okay. Okay, Dr. Adu-Krow, we realize the ministry has already addressed the issue of contaminated testing kits, but from PAHO WHO's standpoint, talk to us about the process and approval verification of testing kits before they're actually used. Tell us a little bit about that, please.
Well, okay. Most of the testing kits that we have come from PAHO, and they're made of 3 parts. One, the swab kits, that is the medium and the swab state. That, and then also the enzyme assay, the enzyme part of it, and then also the actual test kit, the extraction kits. So now the audio that is going around says, oh, we are seeing increased cases because of some testing kits that came from China. And that is incorrect. At least to the best of my knowledge, the sample that was given by the government graciously given by the government of China came to us about 6 weeks ago, 6 weeks, 8 weeks ago. And those were used and we didn't have any problem. Now someone saying that suddenly we are getting increases because of that, that is a lie. That is not the truth. That's one. And 2, PAHO brings these all the testing kits that we have. They go through a quality assurance first, and then go through PAHO. It comes here. They are monitored, temperature sensitive monitoring. So by the time we get them, we know they are in good stead. The other thing that we've also done is to advise government that almost every 50 tests, send the same sample outside the country so that we see whether our test results match the outside test result, just for quality assurance. And that is going to be done. So I can assure you, and also by extension, the public, that the tests that is being done in Guyana are secure, safe, and quality assured. So that if you get a positive, it's a true positive. Now, let me just try and take on the question of someone saying they tested at government and it was positive. They went and tested at private and it was negative, or vice versa. Trust me, when you test at government and it's positive, it's a PCR test. It's a molecular test that is about 99% accurate. Now, if you go and test in private and you go and test with an antibody antigen test, that is not as sensitive as the PCR. And that's why government is sticking to the PCR. And that's why WHO has not pre-approved any of the antibody antigen tests as yet. So I wouldn't put a premium on those antibody antigen tests and put a premium rather on the PCR test.
Okay, Dr. Adu-Krow. So let us talk a little bit about care and treatment for COVID-19. And for the benefit of the Guyanese public, can you talk about recommended treatment and also what is happening in terms of research and how it can be applied to Guyana in that regard?
Well, I must say that in terms of treatment, there are a lot of the treatments out there that WHO hasn't pre-approved any of them. WHO has approved using various treatment methods for research to see whether they are truly helpful. One of them is the hydroxychloroquine, another is the use of HIV medication, another is the use of rheumatoid arthritis medication. So several medications out there with mixed results. And in medicine, once you have mixed results, you must go through a randomized controlled trial. And that is ongoing now. And in fact, Guyana has joined the Solidarity Trial. So we'll be part of that process that will come up with an answer as to whether is hydroxychloroquine really good for us. Is hydroxychloroquine and another medication. Is the timing of the use of hydroxychloroquine the issue? Is it one of the anti-HIV medications? Is it one of the rheumatoid arthritis medications? And all those are now going through research. So it's only after the conclusion of those research that we can say for sure that this is good enough, this is not good enough. That is one. The second point is everything we do, we must ensure that we do not harm the patient. We want to uplift the patient. We want to have the patient get a better health. So we shouldn't rush to do anything that may be seen to harm the patient. And I think and that is where WHO is coming from, and that's why none of them have been approved as yet as treatment modalities. The best cure is to respond to the symptoms that persons have and make sure that they outlive the effect of the virus, so that we can say in quotes that they've been cured.
Okay, and as a follow-up to that, Dr. Adu-Krow, we see that in Guyana, several sections of the society, some persons have started using traditional medicine and they say it has been working for them and all things like that. Can you comment on that as PWR, please?
Yes, I think I must say that I come from Ghana, in Africa, and we use a lot of traditional medicine, herbal medicine. WHO has a wing that utilizes herbal medicine, and it is my hope that persons who claim they have herbal medicine that can treat or cure COVID-19 will come forward and be involved in some clinical trial. Why do I say that? Because most of these herbal medicines, they cannot tell you how often you should take it. Some will say, oh, take a cupful. Some will say, oh, take as much as you can drink. No, it has to be dose related. It has to be a regimented regimen that tells you, okay, you have to take it 3 times a day because if you take it every 8 hours, it's boosted in the blood or in the target organs. So a lot needs to be done. We cannot say that they are not good, but they need to be proven to be good and not to be injurious.
Okay, Doc. So my next question, I'm going to ask it in 2 parts. First part, yesterday the president had an engagement with several stakeholders, and that meeting you were part of, along with the UN resident coordinator. They had the private sector, they had the media there as well, and some recommendations or suggestions were made to the health minister and the president as to how we will move forward with regards to the national response to COVID. Can you tell us some of yours as PWR? And the second part of that question is, if you can tell us a little bit about how PAHO has been contributing overall to Guyana's COVID-19 response.
Well, thank you for that question. I think yesterday was a great meeting. I was impressed with what the president knows about COVID-19 and the fact that he's always reading and calling people from abroad, calling officials in Canada, officials in the US, officials in Europe, and quoting them. I was really impressed. I think when you have a president who is engaged like that. That goes a long way. The other point that I came up with is, yes, we have all these scenarios where we are predicting numbers if we do nothing. If we put in various provisos, so everybody wears masks, everybody does hand washing, everybody has cough and sneeze etiquette, everybody stays home if they don't have to go outside. If we do all that, if there's a curfew, people stay at home. If people are sick, they stay at home and be asked when to come to the health center or go to the place. If we do all that, we can open society. That's one. Two, it looks like COVID-19 is going to be endemic. It's going to be with us for a while. And if it's going to be with us for a very long time, we cannot close society for a long time. We must learn to live with it. And that means that these measures that have come up must be respected. And if they're going to be respected, then we must have government also making sure that it's enforced. And with this, I must say that I think the police and the environmental health officers, private sector, all of us have to be involved to make sure that we implement those measures. If we're able to implement those measures, we'll be able to live side by side, because COVID is likely to become an endemic condition with time. Now, the other thing is, like I said, we cannot protect only lives and leave livelihoods. On the other hand, we cannot protect livelihoods at the expense of lives. So we must have a middle ground, and that middle ground is the population adopting public health measures that have been agreed upon and scientifically proven to help the condition. And the second part of your question is, what has PAHO done? PAHO has helped a great deal, in my opinion, has helped a great deal in terms of providing the technical expertise. Technical expertise not guided only from, not gathered by the PAHO country office, but gathered from PAHO office in Washington, in Geneva, in other PAHO offices. Our learning curve from China, from Italy, from Brazil, from Africa, we're putting all together so that we don't have to go through the same mistakes others may have made. So I think bringing that technical expertise to the ground goes a long way. The second area that we've helped happens to be provision of test kits. I must say that PAHO by now would have provided about 50,000 test kits. Why? When the new government came, they made the request for 30,000 kits. The director of PAHO immediately donated the 30,000. They didn't even allow us to buy. They donated the 30,000. And before that time, we were bringing in 5,000, 2,000, 1,000, 2,000. And then we have also, as an office, purchased about 20,000 for the government. So I think we have, if you put it all together, it's over 50,000. Now, the third area is training. We trained the public health reference lab to start the training. We used to have all our samples going to Trinidad. No more. Now we are doing the lab assessment here in Guyana. And we are also helping with the training of more persons. Now about 30 persons have been trained in terms of doing the PCR test, so that we don't have the backlog. So that once you have your test today, you should be able to have the results tomorrow. That is what we are working towards. And I think PAHO has done a lot. I keep on saying that PAHO is not a bank. If we're a bank, we would have closed a long time ago because we are not good at handling money. But we're a technical cooperation agency, and that's what we have done, and done it in a nice way.
Thank you for that response, Dr. Adu-Krow. And even we know that you are the outgoing PWR. You're now wrapping up your tenure here after I think about 6 years. We want to know from you, with the new PWR coming in and all that, what is some bit of advice you would leave to the new PWR as well as the Guyanese public, if you could say that?
I think for the new PWR, my advice, and I've written them down, and I've talked with him twice. My advice is, please be responsive. Be responsive in the sense that don't wait till government asks for help before you provide help. If you know that government is going to need test kits, order them before government comes. There are many times previous Minister Lawrence will ask, PWR, can you help me with a strategic plan, getting a consultant to do a strategic plan? I said, Minister, I already have one in place. We are yet to sign the contract and it's going to come on board. So you have to be proactive. You don't have to wait. It's up to us to support the government. And also make sure that the government's goal is to make sure that the people of Guyana are the healthiest in the Caribbean. It's our job to support that. So that PWR will have to be proactive. I think also sometimes there are areas that government may not ask. If we think it's a necessary area, we have to go to government. Have you considered this? Minister, have you considered that? We think if you look at this way, it will go a long way. I'll give you an example. When I came to the country, PAHO was not in the business of giving scholarships. I realized that we had a young medical officers pool that needed training in management, and we gave scholarships. To date, we've spent over about $750,000 on training, on scholarships, and some of these in clinical fields, in management fields, in socio-medical fields, they've gone and come back. So I'm very proud of what we as PAHO have done, and that would be my advice for him. Every PWR has their own style, but my idea to him is that please be proactive. Second point, please always support government. We give advice to government all the time. It's not always government takes our advice. It's not only this government, all governments. We give advice, and government will then have to weigh pros and cons and make a decision. Even when government doesn't go with our decision or our recommendation, it's up to us to support government to mitigate any possible any possible negatives that may occur. We have to mitigate that. So we have to always support government, even when government doesn't take our advice. So that's the second point. The third point is we should look at the people of Guyana and say we are here to support them. If we do not do anything positive, then our role has not been met. We have to find ways that we can support them so that they can, that goal that government has set for themselves, that Guyanese will be amongst the healthiest in the Caribbean, becomes the norm. That would be my advice to the new PWR. My advice to the country, I think as Guyanese, we all need to make sure that this COVID, we come together as a people. And do not think about the fact that, well, it's only the elderly. No. The youth are getting it and bringing it home. And it's killing them and it's killing the elderly. Guyana is one of the few places where the young people are being affected and it's killing them as well as the elderly. Please let us all take note. Let us not become immune to the ideas and the messages out there and say, oh, well, they say that all the time. It's going to affect him and not me. It might affect you, and by the time it might affect you, you might belong to the 15% that may need hospitalization. And if you're not lucky, you may be among the 5% that will need intubation. And once you go through the intubation route, you may never come back. So that's my advice. Let's take that advice. Let's make sure that we go by the public health mandate. We go by the public health advice and do the right thing. Guyanese are not supermen and superhuman, and superwomen. We are all human beings, just like any other person. Just like the Italians who died, just like the Americans who are dying. Let us do the right thing so that we do not become a statistic just like them.
Okay, PWR, and we are wrapping up the interview. Do you have any closing remarks that you would like to leave with us?
I think my stint in Guyana, I've been here 6 years, 7 months and counting. Normally, we stay for only 3 years. Each time I was about to move, I was supposed to move to either Trinidad or Barbados. Each time I was about to move, the government stepped in and said, oh, William, can you stay one more year? And now I have to retire from Guyana. It's been a good stint for me. I've enjoyed my stay here, and I've benefited a lot with the interactions, socially, emotionally, psychologically. It's been a worthwhile stint. And You'd be surprised, but now I call Guyana my second home.
Thank you very much, Doc, and we really thank you for your work in Guyana. It is appreciated and it has been noted because you've left your mark in almost every subsector within the health sector. So I would like, on behalf of everyone, to thank you for your time here. And this is where we will wrap up this interview. Guyanese, we were just speaking with the outgoing Pan American Health Organization, World Health Organization country representative to Guyana, and we were giving you COVID-19 updates. Thank you for joining us.
Thanks so much.